Hello, doctors. Today what I want to talk a little bit about is depositions and trials. Okay, depositions and trials, a lot of doctors get nervous about depositions or trials, and it's just part and parcel of the medical legal aspect of injury work. So a long time ago when I got involved in injury work, and by the way, I got involved with injury work because I wanted to reduce the risk that a patient has who has a spinal injury. When a patient has a spinal injury, by research, 55% or more of the patients are never going to fully recover. I knew as a practitioner, as a treating provider, in the trenches doctor, that I could seriously improve those results, that I could do a lot better than that. I could take a patient, put them through a 2-month, 3-month, 6-month rehab program, and have them come out with little or no chronicity, right? And long term, that would reduce down even more. That was my goal as a provider. And that should be the goal of every injury provider. It should be results. And today with the AIs and the things that are coming out, results are going to be the key thing that matters in the spinal injury space. Things are going to change. So the old days of, okay, let's don't get results and let's just go through this process of trying to figure out what's the best way for a patient to get the most amount of money. That's insane to me. Now, I understand it. But the way that patients get the most amount of money is to be disabled, right? Well, who wants to be disabled for the rest of their life? I don't care how much money you pay me. I don't want to be disabled, right? I don't want there to be things that I no longer can enjoy in my life as a result of injury so I can make some money. That's not me. That has never been me, and that's never been any patient that I've ever dealt with, and I've dealt with a lot of them. Now, I'm not saying that there's not people that are that way in the market, but that's not what you're going for as a doctor. Remember, as a doctor, your job is to reduce the need for future benefits. That's called good rehab. Those doctors that can do 3 things in the spinal injury market will be the most highly paid doctors in the market. And only 3 things they got to do. They got to know how to work it up, so they got to know the imaging. They got to know what the imaging, what it means, what an excessive motion test means, what the disc herniation test means. They got to be able to correlate the two. They got to know what the upper cervical injury is. They got to know how it relates to the mild traumatic brain injury. And they got to know that, and once they know that, and once they know that with the imaging, then they basically got to, they've improved their documentation. They got to be able to document things, because when you're in the medical legal space, documentation for spinal injuries is simple. It's not hard at all. But your documentation is what allows the patient access to any benefits they're entitled to. And everybody else on the other side, your plaintiff attorney, your defense attorney, your insurance companies, are all trying to decide the benefits. So the easier you make the documentation and the more understandable you make the documentation and the patient's story, the easier it is for everybody to determine benefits. So you become a severe asset to those people. Right? Now, the third thing that you got to be able to do, so 1, work it up, know what the imaging is. 2, the documentation. You got to keep it simple, but it has to be very, very, you have to tell the story of the patient. And then 3, you got to get great results with these conditions. Man, if you can get great results with these conditions in the future, you will be the sought after doctor. This market is shifting and changing, and we're helping to do that by standardizing the spinal injury workups. That's what I'm very proud of with Spinal Kinetics. We're working to standardize the spinal injury workups so that the treatment innovators can better treatment innovate, and you can get results with these, and people don't have to suffer for their whole lives with these. So doctors, again, your job is to minimize future benefit need. That's what your job is. Now, I knew that I could do that as a private practitioner, but what came with injury patients, so I wanted to treat injury patients, but what came with injury patients was a medical legal situation. Now I'm going to be deposed. I'm going to be deposed by the plaintiff attorney, or I'm going to be deposed by the defense attorney. Right? So you're going to have IMEs, you're going to have utilization reviews. Somebody's going to say that your care wasn't valid, that you shouldn't have delivered it in the first place, you delivered too much of it, your documentation to support your level of care. All of that comes in the personal injury space. Right? And it also comes with depositions. Now, how does CRMA, how does Spinal Kinetics assist you in depositions? It's unbelievable what it does. It's the same thing it did for me in depositions years ago. I used a company called Spinalogic Diagnostics to do my excessive motion testing while I was in private practice. And the reason why I did that is I knew the results of excessive motion testing were so significant that I wanted them done by an independent, unbiased party, third party. And that's why I did it. I did that my whole career. And in those days, I probably could have did it myself in my private practice. Not as well as they did it, but I could have tried to do it. Right? So, of course, you want an unbiased, independent third party. Now, how hard is it in deposition? Patient has 2 levels of rateable, which is where they've qualified for alteration, motion, segment integrity, say in the 5th edition. You're going to have the 6th edition, you're going to have the 7th edition. A lot of doctors don't understand and can't go back. They can't go through the 4th, 5th, 6th, and 7th. And all of them can help you in understanding it. But let's say you got a 5th edition, 2 levels. That's a surgical level. It's at C2, C3, C3, C4. That's surgical level, up in the upper cervical spine. You also have an upper cervical injury that will mimic every single one of the mild traumatic brain injury symptoms. You got an A to PL mouth lateral shift, 3.4 millimeters on the left, 2.6 millimeters on the right, significant upper cervical, craniocervical junction ligament damage. How hard? Now, here's what you did. You did 6 months of care. Here's why you did it. You used outcome assessments to show that the patient was consistently improving. You might have referred out to an allied medical professional for some assistance. Here's why you did it. Here's what the results were. How hard? This is where the patient is now. This is what their future care needs are going to be. This is how it affected their life. These are things that they couldn't do. So they lost the enjoyment of these things. These are things that they could do, but it caused them, flare-ups when they did it. So they had duties that they had to perform that created duress. It's not hard. But having the unbiased, independent read means that you don't have to know about the softwares. See, today it'd be the easiest thing for me to go in and do a deposition with a doctor that's trying to do this testing themselves with softwares that they're trying to use that they don't really have any understanding of at all. And trust me, when you start doing your own studies, technically you have to have an understanding of all of that. Once you start charging for a system that you're using, you're fully responsible for that system. And that's something that I would never want to have as far as a deposition, because now I'm going to focus, if I'm defense, I'm just going to focus on that. And I'm not going to focus on that. Now takes the attention off the injuries. It's the easiest distraction that there could be. You want to avoid that distraction. Now, depositions, when you're good at depositions, lead to referrals. But remember, when I say this, your job as a doctor is to reduce benefit need long-term in the future. That's called good rehabilitation results. So if a patient comes in, I don't care if a patient comes in a wheelchair, and they're wheelchair bound, and they say, oh, it's due to a lumbar injury. Good, we've rehabilitated the injury, and now 6 months later, 10 months later, a year and a half later, I don't care what time zone you want to give it, they can run a 10K run, and they don't need the wheelchair at all, ever again. Have you reduced the long-term care needs of that patient? Absolutely. Have you done what you're supposed to do as a doctor? Absolutely. Now the medical legal is still going to resolve it the way it needs to resolve it. So doctors, your job is to get good patient results. Your job is to be really good and fluent in depositions. Having an unbiased third-party excessive motion read, it contributes to both of that. So doctors, if you're not using Spinal Kinetics, you want to know more about Spinal Kinetics, call our office. If you want to set up an account, call our office. It's really simple. Call our office, find out how easy it is to work with us. I highly recommend you do, and I highly recommend you align with us because of what we're doing in the spinal injury market and the elevation in the professionalism that we provide this environment. I highly recommend or highly ask, join us.